Hello, I'm Dr. Adam Scheiner, and today I'm going to talk about facial rejuvenation to facial transplant, the spectrum. I often speak about why I like to help people with their appearance. Most of what I discuss is related to understanding the impact our appearances play on how the world views and relates to us. When I cover these topics, I explain we are biologically driven to evaluate each other based on the 3 Ds of aging. 1. Deterioration of facial skin. 2. Deflation of the face. And 3. Descent of the face. It's true that typically when we first meet one another, we evaluate each other's eyes and mouth regions. We then evaluate each other's skin tone and appreciate clear, beautiful, and even skin. This happens quickly and on a subconscious basis. We aren't being shallow, it's just how our brain works. Our subconscious then tells our conscious mind how we feel about that person based on what we see in those areas. If the skin is irregular, we may see the person as older or sick. If the eyelids are heavy or baggy, we may form the opinion that the individual is old, tired, sick, sleepy, or even hungover from too much alcohol the night before. What does your mind see in the photo of this patient on the left when he first came to see me? Does your opinion change when you view the picture on the right, which shows him after I performed lower eyelid rejuvenation surgery? This patient was a teacher, and his students often thought he was sick, fatigued, or drinking too much based on the nonverbal cues from his lower eyelid fullness. These comments ceased after this area was improved with surgery. Now his students can relate to him without the eyelid fullness shaping their opinion. Let's look at another example in the picture of this woman. What opinion does your mind form of this woman when viewing the photo on the left? Does she appear happy or stern, approachable or not? What does your mind see in the photo on the right? Can you clearly see she now appears more open and approachable as well as more pleasant? The only thing that changed for this patient was the heaviness around her eyes. These 2 photos are before and after my Botox brow lift procedure, which made a big impact on the way other people related to her. When you look at the mouth area and see a loss of volume in the lines around the nose to the corners of the mouth and also from the corners of the mouth to the jawline and jowling in the jawline, we often assess that the person is older or sick or less vibrant in appearance. Check out the additional before and after photo here. Stop and consider how your mind interprets my patient's photo on the left and then on the right. By restoring the volume of youth to her lower face, she found that others viewed her as younger and more vibrant. I enjoy the fact that I can help my patients with all 3 Ds of aging with outpatient procedures that have quick recoveries. When I assist patients in these ways, the reward is twofold. The world relates to them better, and I experience great professional satisfaction and joy from helping my patients. With this as a background, I'd like to share a story about a recent medical meeting I attended. At this meeting, a doctor who helped perform the first facial transplant in the United States, Dr. Daniel Alam, spoke about his experiences with his surgery. He began by reinforcing what I have been saying for years about how we relate to each other as people. We evaluate each other's key areas for nonverbal communication, the eyes and mouth region. When either of these areas is made more attractive, the whole face can appear more attractive. In this way, these areas hold special power in how our subconscious brains communicate with the conscious brain. The doctor went on to say that our personal identities revolve around the central parts of the face. He referred to research which showed we look at each other's eyes and mouth as we communicate with one another. A recent research paper by Carol Blaise and others entitled Culture Shapes How We Look at Faces discusses cultural differences in how we evaluate each other and showed that the central areas of the face absolutely dominate nonverbal communication. To illustrate this research, the doctor showed in his presentation how we can take the photo of our current president, cut out his central portion of his face, and place it on another person. After doing this, our brain still tells us that this is President Barack Obama. In actuality, this photo is of actor Brad Pitt with President Obama's central face superimposed. The doctor then discussed that in certain medical cases, the central face can become distorted. He showed one of the first facial transplant patients in the United States who suffered a gunshot wound to the face. In this unfortunate case, the woman's husband, in a situation of domestic violence, shot her in the face and then tried to shoot himself. Both survived, but Connie Culp was left with a massive injury of her central face. Her subsequent surgeries left her with a distorted face. The surgeon discussed how our identity is defined by these central facial areas and how, in cases like Ms. Culp's, her injury made it difficult for her to be accepted by others. In our society, people may have trouble being friends with Ms. Culp based on her appearance. Although we like to think that we relate to others mainly by what we and other people say and do, the nonverbal language that influences our subconscious mind does indeed influence the way we interpret each other. We yearn as social human beings to relate and interact with one another, and an injury such as Ms. Culp's made it difficult for her to build new relationships and friendships. In fact, Ms. Culp shared that in the deformed state, children would often run away from her and call her a monster. Children don't have the mental sophistication to allow them to overpower their initial subconscious impressions. But what they see, we subconsciously see in the same way. Fortunately, Ms. Culp lives in this age of incredible medical advances. She underwent one of the first facial transplants in the world. Now she's having an easier time living life and experiencing more acceptance from others. These days, children don't run away or call her names. The people she encounters relate to her in a more positive way. The sophistication of these procedures will continue to advance and give hope to others with serious facial injuries like Ms. Culp's. What I found so intriguing about this procedure is why it was performed in the first place. The surgeon performed the procedure in order to help this person relate better to others in the world. This is the same reason I love doing what I do. Helping my patients restore, reveal, and reclaim their natural beauty helps them relate better to others in the world as well. It's powerful for our patients, professionally fulfilling for us as doctors, and it's all along the same spectrum. Thank you for tuning in to Adam Scheiner, MD TV. I hope you enjoyed learning about ways I help people restore, reveal, and reclaim their natural beauty. Please check back for more discussions in the future, and please share this with your family and friends. Goodbye for now, and I wish each of you a beautiful day.